As more vaccine becomes available, a broader group of people will be eligible for it. But who gets it after healthcare workers and nursing home residents? That depends on which state you live in. Here's Katie Beck.
In the war against COVID, states are armed with a new weapon.
The cavalry is coming. A vaccine is on the way.
The state of Maryland ready with a priority plan to vaccinate. Phase 1 includes long-term care facility residents and healthcare workers, then first responders and those with high-risk conditions. Phase 2, essential employees, and Phase 3, the general public.
Ultimately, it is not the federal government decides, it's not the CDC that decides, but states and jurisdictions that decide.
Many states are still grappling with who comes next in line for the vaccine after Phase 1. Regionally, priorities can vary. In Kansas, Phase 2 will put a high priority on workers in the meatpacking and grocery business. Across the country, 48,000 in the industry have been infected with COVID. Another 350 have died.
They are given special consideration given the fact that they do work in high transmission points, and that they serve such an important function in our society.
There's roughly 90 million essential workers nationwide, but defining an order to essential, a huge challenge. An early plan in Louisiana puts prison guards and food processors ahead of teachers. Ohio and California giving priority to disadvantaged communities.
Poor and low-income people and low-wage workers at the end of the line for a vaccine, but at the front of the line for giving.
Ethics and health policy expert Dr. Harold Schmidt says states need to consider their demographics carefully to determine who is most at risk.
When it comes to the elderly population, we want to, again, be mindful of the fact that just because you're old doesn't mean you're at risk.
For the many Americans eager for their shot.
What mentality should they be adopting right now?
Patience, definitely patience. We all need patience. We all want to know when is it my turn in the line, but it's not about us, but about all of us.
Katie Beck, NBC News.